Hey, deserving listeners, couples therapy. Let's watch and see what comes flying out of my face.
They explained it. Each of them explained it.
I
in their
didn't
own
get an
ways.
explanation personally.
You weren't
yet.
a home either.
I wasn't a home either.
Because the home is not outside.
Yeah.
He was the one who left.
Okay, so this is the consultation group, and she's saying she didn't get an explanation, so it was probably an email or something saying we think that we want to cancel our next appointment, and I think we're going to terminate therapy, or clients don't usually use that language, but they'll say, we're going to take a break from therapy for now, or we're going to look for another therapist, or thanks for all your help, but I think it's not really working, so we're going to bow out of therapy, something like that. So she didn't get an explanation. And then we hear another consultant say, you weren't a home. So, they've had rich, long conversations that we haven't witnessed about Boris, that Boris is looking for a home. And I'm encouraged by that language because that's the way I was seeing it. I mean, it's not the exact words, but that is the primary problem, that he's looking. I'm using the word promised land because to me that is more indicative, because home is one thing, but I think he's looking for a fantasy promised land, an oasis in the desert of his emotions. And he became locked in as a child, maybe his family did too, with this fantasy. And his suffering is real, and his solution is a fantasy. And there is a solution to his suffering, but he's too locked in on this one idea and has a hard time dislodging that. And he unconsciously adheres to it because it gives him the ability to alienate Jessica and maybe the therapist to confirm his assumption that people will always discount his feelings, because there's no way to validate his feelings around this because they're so illogical. They don't make any sense. The catastrophization that he's even said, it's a catastrophe, and you're just like, what are you talking about? It's just a water filter, or I just bought these tomatoes. It's not a catastrophe. But because he's so locked in on that, he alienates people in an unconscious way to get them to confirm what he believes to be true, which is that he's always going to be discounted, I think, the way that he was when he was a child.
Or was it both of them?
I'm sure it's him.
Yeah, that's what I think.
I'm
too.
sure it's him.
Yeah.
Right, so she's convinced that Boris is the one that terminated therapy, and it is quite possible. It wouldn't be strange if that were the case. She knows more about who was the one who initiated therapy. I at first assumed it was the wife because, to be frank, often it is the wife because of gender socialization, that men are told that they shouldn't ask for help, that they shouldn't be vulnerable, blah, blah, blah. But also because the wife is a therapist. So you would imagine that she would be the one to seek therapy. And she's also the one that's sort of needing of support, right? But I also wondered if Boris might have been the one driving therapy. We just don't know. But she's assuming that it's Boris, but I could see it being Jessica. I could see it being both of them. Not because Jessica is upset with Dr. Orna, but that Jessica is done with the marriage, and is like, I don't want to have to sit in a room, because I've seen this from clients where it's just like, I'm so done with this person and I'm so aggravated around them that I want to spend as little time as possible with them, and I surely do not want to sit in a room while they complain and I have to listen. Like that is I've done that my whole life, or our whole marriage. I don't want to do that anymore. I can't do it. It's intolerable. I'm done.
I think the question would be, what about it for him specifically is intolerable?
Yeah.
But I don't know if he would be able to say.
Right.
Yeah.
For a while, I was thinking, maybe she really isn't offering him enough empathy. And I tried in the session to see if I can get her to, address his hunger.
Yeah, this is really quite satisfying for me to hear her talk in this way, because that's how I was feeling also as a clinician. And it also seemed like she was feeling that way, and that's what she was attempting. So it's good. I do remember that the older guy in the consultation group often said things that I agreed with wholeheartedly, in contrast to some of the other consultants. I think there are some new faces, if I'm not mistaken. I'm not sure, from the season I watched last time, but I heard him say something that I was like, oh, good. Yeah. So let's see if he says something else.
But nothing worked. But also, I think she was happy to see that someone's seeing, look what I'm dealing with.
Yeah.
This is impossible. You see, every time I try, he just says, no, not enough, not good enough.
Did he identify with you at all?
He briefly identified with me when.
All right, just chiming in here. The rest of this video will be for members of the YouTube channel. Otherwise, please take care of yourself because you deserve it. You really, really do.